Yes.
Okay, we were talking about nitroglycerin under the tongue and,
Put your hand down.
oh yeah. We're, what were we talking about? And then we were,
Yeah, there's 3 risk factors.
the risk factors, we were talking about the high blood pressure, smoking, and high cholesterol, and, the ambulance, and then nitroglycerin sublingual. If you, does anyone know what a cardiac diet consists of? Probably so.
Low fat.
Yes. Low fat, low cholesterol, and low sodium. And it's important to check that whenever you're getting food. I know it's hard to get the low sodium, but you don't want to do no sodium because then you know they'll give you supplements to bring that back up if it's too low. What else is there? Oh, has anyone ever had a stress test or anything like that before a heart cath or?
I had a stress test and I had a heart cath.
Yeah. Did you have stress tests before your heart cath or different times?
Yeah, I've had and still have stress tests.
Yeah.
Especially if I'm going to have surgery or anything more. Do a stress test.
Yeah, if your chest pain isn't too bad where you can kind of have a stress test done before a heart cath, they might do it that way. It just depends on.
I had the nuclear stress test
Oh, really?
because I have a problem with my legs. I had a normal stress test and I had to step off and he said, well, your heart's fine. And I said, it isn't my heart. It's my legs and my calf. I'm very, very thin legs. Not quite as thin as yours, but almost. But my calves were like that.
legs.
And so anytime I have to have a stress test, I have to do the nuclear.
I have to do nuclear too.
Well, because yeah, with your stroke, you can't do a normal stress test.
Yeah. And they usually have meds with the nuclear to speed up your heart so you don't have to exercise.
That is the weirdest feeling.
Yeah, I don't like them.
Turn off the camera.
Yeah.
Because you honestly think you're going to pee your pants.
Oh, really?
Oh, my, yes.
You have that feeling?
Did you have that
I
feeling?
didn't have that feeling, but oh, it was
Oh,
terrible. the
I
feeling
thought
that-
for sure. I thought my bladder was boiling. 'Cause that's how bad I had to go. It was really weird.
It's affect different people different ways.
Yeah. Let's see. The stress test evaluates the effectiveness of your heart medications to control your chest pain. It determines the likelihood of having further evaluation, maybe a more invasive like a heart cath. If the stress test shows something, they want to go in a little more and look. And it checks the blood flow within the vessels, which a heart cath does a little better because you can actually go in there and see. And then if there's a blockage that cannot be fixed with a heart cath, with stenting or anything to open the arteries, then they might recommend open heart or angioplasty, go in there and fix that vessel manually on the outside. So, does anyone want to talk about anything or have anything else to?
What about exercise?
Oh.
After a heart attack?
Oh, you have to gradually, as tolerated. Nothing strenuous, no lifting. You want to kind of keep it easy for a couple weeks, especially after a heart cath, like especially with stenting. You just want to take it easy.
What about weight control for heart? Are heavier people more prone to heart attacks than the other? I remember when I was pastor in the Hannibal Clarington Parish, I had a gentleman who was a marathon runner. And he was practicing for the Wheeling run, and he had a heart attack before that, just his normal running. And yet he would have been considered someone who would never have a heart attack.
I think if you look at Debbie Decker, you would never think that she had heart problems.
Yeah, it's-
Because of her weight and her health and,
You know, I mean, she just looks like someone that wouldn't be a candidate for heart problems, but she does have heart problems.
What is your family history of it?
Yeah.
that's another
That's a
another
lot to-
factor.
It's a lot
That's
to do
one of
with
the
your
first
family.
questions doctors ask you. Do you have heart problems in your family?
I don't
I
think-
have it on both sides.
I don't think it's much to do with weight or anything like that. I think it's your genetic makeup, just what, everyone's different. So it just depends on your family history, and that's why, that's one of those questions that they want to know. It's hard whenever you get patients that were adopted or something and they don't know it.
That's me.
Yeah, because it's hard.
I don't
'cause-
know
yeah.
anything about my real family at all.
Mhm. And
So,
that's hard, because.
I can't tell them anything. I don't know.
Yeah. But, and is there, I really appreciate everyone coming here tonight and, waiting on me to get here, and I think that's it for my, thank you all for coming, or listening for a couple minutes and waiting on me.